Afternoon, Mecklenburg County leaders will meet with doctors from the CDC about the county's response to coronavirus. CDC Director Dr. Robert Redfield is expected to talk about the importance of contact tracing. It comes as North Carolina set one-day highs for new COVID-19 cases and hospitalizations on Saturday. Contact tracers determine who may have been exposed to an infected person so they can quarantine and limit the spread of COVID-19. But it's proving to be difficult work. And we told you last week of the more than 5,000 cases the county has worked since early June. About 25% of patients didn't have enough information to contact someone. Well, that means asymptomatic people could have unknowingly spread the virus. Well, today, the county will get some advice from the head of the CDC on how to be more effective. Channel 9 will have complete coverage of today's important meeting, and the meeting is set to start at 3:30, which we will bring to you live on air, and we'll have a team coverage today starting at 5 o'clock. Well, we are expecting Governor Cooper to make an announcement on what's happening with schools in North Carolina nearly 1 month before students are set to go back. Cooper was supposed to make an announcement on back to school plans 2 weeks ago, but he canceled the announcement saying he needed more time. During a news conference last week, Governor Cooper did seem to indicate the plan would include a combination of in-person and remote learning. That is one of 3 options on the table right now. The other 2 options are in-person classes with safety measures or remote-only learning. North Carolina leaders are still discussing how to reopen schools. Right now, it's not clear when exactly this week he'll make his announcement. Well, U.S. Education Secretary Betsy DeVos says your kids won't be in danger of getting COVID-19 if they go back to school this fall. Well, she's joining President Trump saying school should be in person, not virtual. She also says schools don't have to follow the CDC's guidelines for reopening schools because they're meant to be flexible.
Kids need to be in school. They need to be learning. They need to be moving ahead, and we cannot be paralyzed and not allow that or not be intent on that happening.
Well, the CDC guidelines include keeping desks 6 feet apart, installing barriers like sneeze guards, and encouraging kids and staff to wear masks. In South Carolina, Governor Henry McMaster said Friday he hopes students can learn in person next month, but the group SC for Ed is against in-person classes this fall. Our partners at WPDE report the group is made up of teachers from all across the state. They say school curriculum should remain virtual until COVID-19 cases decline, and the group says teachers across South Carolina feel they are more prepared for school to be online instead of in person. Well, a rare mysterious child illness linked to COVID-19 is now in South Carolina. The state confirmed 2 cases of multi-system inflammatory syndrome in children. Now, we know both children who have Miss C are younger than 10 years old. One is from the Midlands and the other is from Petey. Well, we started telling you about the illness back in April when cases were first reported overseas. Miss C started showing up in the USA a month later. Doctors aren't sure what causes it or why it's associated with COVID-19, but it can be very serious and even deadly. Symptoms include fever, abdominal pain, and rashes. Well, many of our neighbors and friends, even family, are still without a job because of the coronavirus pandemic, and many of them have been getting that extra $600 each week in unemployment. Well, that's about to end in less than 2 weeks. It's been a very political issue, but let's look at the consumer side of things. Action 9 investigator Jason Stujanki is live in South Charlotte. And Jason, what's going to make a big difference for many when it happens?
Yeah, this is certainly on the minds of a lot of people, Damani. You remember this is all because of the CARES Act. Federal lawmakers passed that back in March. And of course, at the time, July seemed so far away, but look, here we are now. It really snuck up on us, and you have to think the extra money stops for everyone, not this weekend, but next, and that's certainly something to think about. $600 less every week. Now, the federal government could always extend it and has been talking about it with the HEROES Act. Now, that passed the House, but stalled in the Senate. Doesn't look like it's going anywhere. And Republicans have talked about another option, about giving people a bonus for going back to work, but it's not clear how much traction that's getting either.
I'm really hoping they extend the money, but I mean, if they don't, I can't control it. I mean, what am I going to do? I'm just kind of hoping that I can weather the storm.
And I posted a reminder about this topic on Facebook. And Damani, I'll tell you, this is such a hot button issue. There are a lot of people who feel that the $600 was actually a mistake, that it encouraged people not to go back to work, while others, of course, tell me their stories, tell me that they've been able to stay afloat because of the extra boost.
Yeah, there's arguments on both sides of this. Jason, before we let you go, there's still people who are missing their money. Now, you're going to tell us more about their situation coming up tonight at 6 o'clock, correct?
That's right. Not only are we looking forward, we're looking at the present. There are a number of people who should have been getting $600 each week and have not been able to get that money. In fact, someone named Mauricio just emailed me about an hour or two ago asking me that very question. So I'm looking into that, and I'll make sure I have a full answer on how you pursue that side of things coming up today at 5.
All right. Jason, thank you so much for that report. Well, there's a growing divide between Dr. Anthony Fauci and President Donald Trump. This weekend, the White House appeared to publicly diminish Dr. Fauci by sending out opposition research on him. It included interviews or statements he made early in the pandemic that proved inaccurate later on. They didn't include or acknowledge similar misstatements from the president during that time.
Dr. Fauci is the most respected voice in the country on how we ought to be dealing with this pandemic. And to be trying to sideline him or diminish him or discredit him is just atrocious.
Well, several states are still seeing major spikes in cases, including North and South Carolina, Florida, and Texas.